dining area is all updated, which is really nice now. There's tons of space around the table for the residents, to get the residents into their seats and around, because most everybody's in a wheelchair, and maneuvering in the old dining area was really impossible. They move somebody out, put somebody in, and put it back. So we have all that. We also, we don't need a motion or anything for that right now. And then we have our Board of Health minutes from 4/20. Any discussion on that? Anybody would like to talk about anything related to that? Okay, no. And so next we move into old business. Does anybody have any old business that they would like to bring up, discuss, talk about? Apparently not. So we'll move on to new business. So our first thing is renewing the contract for diabetic supplies for Sunny Hill Nursing Home. Can you say anything? Oh yeah, there she comes.
Good morning.
Good morning.
This is a final renewal on our bid from 2014. This is with our current vendor, Professional Medical. There's 2 items on this bid for diabetic supplies, and it is with the same amount, no increase.
Oh, it's good.
Yeah, and this is effective September 1 through August 31st, so then we'll be redoing the bid next year.
Okay, great, thank you. Second. Motion by Collins, second by Trainier, all in favor?
Aye.
Motion passes. Thank you very much.
I'm sorry, and that was with Ms. Severo's approval, always.
Always. I know.
Always check first.
I know Karen, she's a tough cookie there at the Sunny Hill Nursing Home. So, we next have our second new business item is amendments to the Rural County Chapter 53 Water Well Permit and Water Supply Ordinance. And we have Elizabeth and Sue. Thank you.
Good morning, everyone. As you can see from the document, we are only making a few changes in the document, and really it's all related to fees. We're looking at increasing some of the fees on the Appendix A fee schedule. We haven't increased fees here for how long, Elizabeth? It's been
Fees?
Yes.
We haven't increased fees.
Since the inception, or?
Correct.
Yeah, since the inception of the ordinance. So, as you know, part of our strategy, trying to maximize our revenues with our financial woes, is to look at all of our revenue. And so we're looking at increasing fees where we can. These have not been increased for quite some time, so we're looking to do that. And it's pretty minimal. We need to stay competitive, though, so that people use our services and not price ourselves out of the market. And it'll, of course, cover costs.
Right, and they don't look like they're that, astronomical. $3 here, $8 there for
Right.
increase. So that's not too bad. Very reasonable, I think, for. I know a lot of residents out my way come and use it because it is a good. Yes, it's a good value.
There are businesses that also use it in the area, and they're glad. They want to maintain, they like to have a laboratory, certified laboratory so close, so
Right.
they use it as well.
Right, that's nice.
And with the state lab doing less and less, we actually are getting some more customers that
Oh.
have utilized the state lab. The state is actually sending us samples also.
Jake, go ahead.
Is this really enough of an increase, I guess is my question, because it is so minimal.
Yeah, my lab manager did a cost analysis for all the samples, including chemicals and her staff time, and this is what she came up with. And she's very good at doing the cost analysis. And you'll see when I come back, hopefully next month, with the sewage ordinance, we did the same thing with our analysis on the sewage end too.
You said 8 years.
Well, the ordinance was created back in '89, and the fees were separate at that time. They weren't in the ordinance. They were put in the ordinance actually in 2009. So the fees pretty much have stayed the same.
They won't stay the same that long next time. We'll be putting this on kind of a regular cycle like we do with many of our other fees, to look at them probably every 3 to 5 years.
Because I just think of all the costs behind it. The rise in healthcare, the rise in fuel costs, the rise in heating costs, electricity. I mean, geez, I'd be thrilled if one of my bills only went up $3 in 8 years. I'd probably do a handstand and a cartwheel, and then I'd go to the chiropractor. But yeah, so this does seem awfully low, but if you've got numbers to back it up, then.
And a lot of our customers bring the samples to us, so that's a cost savings on the county also. We're not out collecting them. We have several customers that, they bring the samples to us themselves.
Mike?
Yeah, I just want to go a little further. So that takes, cost analysis takes on everything, labor,
Correct.
building costs.
We look at the labor, we look at the chemicals, we look at, for some of these, we look at mileage and the time it takes them to take a sample. Typically, we don't go out and take one sample. We're out taking multiple samples. So, and to take a sample it's very quick, and if you're taking multiple samples in a day, the cost really is cut down. One person's out, they're taking the samples, they bring them in. So, correct.
Right, so they go out to a certain area, do
Oh,
the
yeah.
whole area. They don't drive to Plainfield, then drive to Beecher, and then go to Romeoville or.
For example, for nitrites, our goal was to collect between 20 and 30
Sure.
a day, and multiple staff members would go out, and that would be their focus, is to get as many nitrites as possible, so that we would have a bundle of them, basically. So,
Steve?
Are there private companies that do the same thing?
oh, correct. There's Aero Lab. That's in, I believe, Joliet or Crest Hill. There's PVC, which is, I believe, in Peoria. This First Environmental, which is in Naperville. There's a couple other labs.
So if the health department eliminated that program entirely, would the private companies that would have to be forced to do it be charging the same thing as you guys now?
We are very competitive with the private company, but the problem is a lot of the samples we collect ourselves. So we would then be taking them to another laboratory and paying them to do the analysis for us, driving them to Naperville or Crest Hill or Peoria or whatever, depending on the analysis. So a majority of these samples, our lab does all of our wastewater samples, our beach samples, so our field samples. So our lab does so many other analysis for our own staff.
I wouldn't look to get out of it, but at the same time, I don't want to be, government should not be competing with private business because they can't compete with us. So, I don't want to price them out, all their workers out of jobs because we're, you know what I mean?
No, I understand. So these obviously, we have to set these for our own customers. So it really is the convenience. If someone from the community wants to bring us a sample, we're there. So, we still have to have that capability for our own analysis and our own facilities that we have to sample for. So that's what we're really
So
shooting for.
we're competitive, but we're not really competing.
No.
Correct, right. We're not competing, we would not want to get rid of our laboratory. Our
Well,
laboratory
I
is,
didn't mean that, I was
Yeah.
just trying to, work it out in what I was saying.
Yeah, no, we're not competing and trying to take their customers, but we have so many of our own samples to analyze that it's definitely something we have to maintain.
Right.
Because we could not outsource all of that. And then if other individuals, they like our service, they like my staff, they come back all the time. We have a lot of repeat customers that just like coming and, visiting. They chat with my, receptionist, and they like just coming here to Joliet instead of having to drive to Naperville or ship them to Peoria. So we're more of a convenience for them.
Yeah, because we're not competitive. We're doing service we get to do anyway.
Correct.
And now what we're doing is supplementing that service with people that want to use us.
off the street, yeah.
That's right.
Because-
Right, that's right, Steve. That's, the thing is, they have to do certain testing themselves, required by law. And then, since we have the lab, we have water services testing for other people, and that supplements your department.
Correct.
Exactly.
And I take it as a compliment. We are a certified lab, and Kankakee Health Department now is bringing us samples. IDPH now shipping us samples. So obviously, they feel that we're a very, responsible, certified lab to go to. So those are two of our new customers.
Right, it's a quality program.
Me still low. Low, not there.
Right, well, it's good that Kankakee County, because they are having a lot of trouble down there. So it's good for them to be able to come to us and do some of that. It helps us by getting more customers, so that's great. Okay, yes.
when is this going into effect? Don't we have to have a public hearing? And then you come back next month for the public hearing?
I
And
think
then
so.
I believe so.
with the resolution?
You also mentioned that you're doing the sewer next, you're gonna be reviewing that in the next couple months, Elizabeth?
Yes,
The sewage ordinance.
The sewage ordinance, the pool ordinance, it's that cycle at that time, so.
So it's gonna be coming like back to back then? Do you wanna,
Hopefully.
want me to publish the public hearings together, and then you can, Judy, if we can
Do one.
do them together?
Do all
Do all of them at once?
Well, we still have to go before June with the sewage.
What is your effective date for this one? When did you have in mind?
Whenever you guys are good.
Whatever gets through the process.
Whenever.
Let's do it together.
Is that what you'd like,
And
or?
then they do the sewage.
Well, I'm trying to make it convenient, we can do the publication all at once if they'd like.
Well, we need to take it to our board first to make sure that they're okay with the changes in the ordinance first. So we could move forward with this right now. Sometimes the sewage ordinance takes a little bit more working.
So we'll do
through.
this one in July, and we'll
Mhm.
pass it in July then?
Yes.
Mhm.
Do that?
Yeah, we'll do that, and then you can still bring that other stuff to present it like you did today.
Yeah.
And then we'll do the next public hearing when you're ready for that one.
Yeah, there'll be more changes in the sewage ordinance other than just fees.
Okay,
So we'll do public hearing next month.
okay.
Thank you. You're welcome. So,
We have to pass this, correct? Make a motion?
yes.
All right, I'd like to have a motion to approve the amendments to the well and water permit.
Motion.
Second.
Motion by Trinier, second by Theory, all in favor?
Aye.
Motion passes. Thank you. Thank you. We don't have to have a motion for a public hearing.
No, we'll do that next
We'll
month.
just do a
We do the motion for the public hearing next month? Or we
When
do
you
the
have it.
hearing?
You do the, you'll do the hearing
We'll just
next
do it.
month, and then
Okay.
pass it all, and yeah. I'll do the publication ahead of time.
Okay, good. Okay, so the next we have a presentation from our Will County Animal Control. I received quite a few calls here and there about this issue with pit bulls or kennels or whatever, and I thought, I don't know enough about what the department does. I call in, they give me the answers. I thought it would be great to bring it forward so that everybody could understand what they're doing for the county and the residents out here. So they've been nice enough to put this great presentation together for us. And you guys have a PowerPoint presentation, and then we're going to go through it. Thank you. Would you guys all introduce yourselves, please?
Good morning, Judy and the committee. My name's Dr. Michelle Rossler. I'm currently serving as Deputy Administrator for Will County Animal Control. I've been with the department since 2012. To my left is Dr. Lee Shield. He's our current administrator for animal control. To my right is Mrs. Sheila Bufano, and she's our senior administrative specialist for the department. And as Judy said, she invited us here to give everyone a better understanding of the role our department plays in the county. And so we put a presentation together for you, and we're going to give you some key themes that we focus on throughout the year. So the first slide is our purpose. Will County Animal Control is responsible for protecting the health and safety of the citizens of Will County by a few key important factors: enforcing state and county animal control and welfare laws and ordinances, preventing and controlling rabies through rabies registration and bite investigations, and that's through the Animal Control Act of Illinois, as well as our local ordinances, and that's a very key role in the county and the state, as well as, of course, the United States. Protecting animals from abuse and health hazards, and this correlates with the Humane Care for Animal Act in Illinois, as well as, again, our ordinances. Again, one of the key things for health hazards would be rabies infection. And we also promote responsible pet ownership, and our key role for that is our spay and neuter program. Next. Our office is located on Cedar Road, just south of Illinois Highway, which is south of Route 30. We are in a two-story building, and we are comprised of 13 employees. We have 4 animal control officers who go out into the field, 2 clerk dispatchers, 1 animal placement coordinator, 2 data entry clerks, accounting assistant, and 3 of us here. To give you an idea of our 2015 activity last year, the number of animal bites that we do investigate and are reported to us was approximately 1,300. The number of complaints citizens have that call in and are investigated, a little over 1,100. The number of animal registrations entered into our database, which is basically rabies registration after vaccination, is approximately 100,000 in the year. The key topic I want to talk about is our rabies vaccinations and registration. Currently, we have 125,000 animals that are up to date on their vaccinations and reside in Will County. Rabies vaccinated pets, again, protect the residents of Will County, primarily dogs and cats, but there are rabies vaccines for other pets, including ferrets and equine. But we enforce dog and cat vaccinations. 99% of people who might contract rabies, which is our primary concern, as well as the pet population, but 99% of people who would contract rabies would die from the disease. So it's a very important disease in the public health sector. As far as rabies surveillance in the United States goes, there have been approximately 34 cases of human rabies in the United States since 2003. And these numbers come from the CDC. Approximately 80 to 100 dogs and 300 cats are typically seen in 1 year in the United States infected by wildlife that carry rabies when pets are not vaccinated. And this number is about 8% of all rabid animals reported in the United States. There are others, of course, that typically carry around rabies, and that occurs in wildlife. Primarily here, we see the bat population infected with rabies, and that will be 30% of all cases reported in the United States in animals. Raccoons occur on the eastern coast, about 30%. And skunks will occur in the northern and southern central United States. We have not seen a case of skunk rabies here in a number of years, probably over a decade. And the fox will occur in, rabies in the fox will occur in Texas and Arizona. The virus.
Excuse me,
Yes,
so why is there such a difference as to, like, here we have bats, and you just saw it on the news yesterday, some lady had a bat in her house that had rabies. Why don't we see skunks and raccoons and fox here and bats? Why is that, do you know?
Well, it's an interesting topic, and it's probably a matter of time. It will occasionally occur sporadically in all these species throughout the United States, but the primary focus, it depends on a lot of the epidemiology of the virus and the strain of the virus. And typically in raccoons, what is keeping everything to the eastern side of the United States is the Ohio River Valley.
Oh.
So,
You don't have coyotes.
pardon? That's correct. That's correct. Coyotes do not typically carry rabies virus.
They are susceptible, though.
Yes, all mammals. All mammals are susceptible to the rabies virus.
Coyotes throughout where I live anyway.
Yes.
I think
Yes.
everywhere in the county.
I'll add to that with, it was back in the 70s, the rabies in skunks was very prevalent. In the Buttone area, if you saw a skunk during daylight hours, you could almost be assured that it was positive with rabies. And the state still monitors roadkill on skunks. Any of the police enforcing agencies that see dead skunks on the road is reported to the state, and they monitor that because they think that the more dead skunks there will be on the roads, the the incidence of rabies is going to increase, because many of those are diseased, and that's how they happen to get hit on the road.
Yes, out of all the mammals besides bats, I think skunks would, the state does want us to test if indeed we do come across a skunk with abnormal behavior.
I saw one in my neighbor's front yard last week during the day.
And they are typically
I
nocturnal.
mean, it was in the morning, but really?
So the rabies virus does result in 30 to 60,000 Americans per year receiving post-exposure treatment in order to prevent them from contracting rabies, and that's through a bite wound typically. Rabies surveillance worldwide, there is definitely a far-reaching global impact, and rabies worldwide is not very well controlled. Canine rabies in particular will cause 59,000 human deaths every year globally, and over 50% of these deaths occur in children, typically in Africa and Asia, under the age of 15. So it's a very important disease to be monitored. Again, canine rabies is not controlled successfully in developing countries, and this is primarily due to large stray dog populations in these areas, and the stray dog populations are not vaccinated because there is such limited funding for that. Canine rabies is successfully eliminated in the United States. And this is just an idea of a map to give you an idea of the impact globally of rabies. And at the top, you will see human rabies deaths occur, again, primarily in Asia and Africa. The second map is per capita death rates per 100,000 persons. And as you can see, United States and Canada are virtually free of any human rabies deaths. It does occur, however, in the United States, approximately in 1 to 2 people per year. So, I mean, given that number, it's a very small number, but I think in the wisdom I have learned from Dr. Shields is that if it does happen to you, it's a very huge impact to yourself.
It's 1 out of 1.
It's 1 out of 1 at that time. So we strive for a successful rabies control program, and with that, I'm going to let Dr. Shields speak for a few moments on our spay and neuter program.
Thank you, Dr. Rossler. We started the spay and neuter program back in 2007. In 2006, the state passed legislation that allowed us to put in a 2-tier fee structure for registration of animals. And at that time, we started charging $50 for a 3-year registration for a non-neutered animal and $25 for a 1-year non-neutered animal versus $8 for a neutered 1-year registration or $25 for a 3-year neutered registration. So we took this differential money and we set that aside to use it for a spay-neuter program. And that is how we have started funding this program. And let's move on to the next slide. We started the program in 2007. At that time, we would run it 1 month of the year where we contribute $40 toward the fee for spaying or neutering a dog or cat. And there's certain requirements. You have to be a resident of Will County, only 2 pets per household, and they need to be currently registered and vaccinated for rabies. And as the program became more successful, in 2012, we went to doing it 2 months out of the year. We would do it in February and again in October. And now we are doing it 3 months out of the year. We do it in February, June, and October. And the numbers have continued to increase. Over the course of this program, we've assisted in approximately 13,500 animals being spayed and neutered in our county. This goes a long ways to cutting down on the stray animal population. If you would multiply that times the number of animals per litter, we have avoided a lot of animals, possibly just running at large and being strays.
I have a question then. So
Yes.
do other counties do this as well, or is this unique to Will County?
Cook County runs a program. They do it in the month of February, and they have been doing it for several years prior to us starting the program. And it was upon seeing the success of their program that prompted us to do it once these funds became available for us with a two-tier fee structure.
Do you have to be in the unincorporated portion of Will County in order to register?
You
for the
do not.
program?
Any resident of Will County.
Okay, thank you. And that's $40 in February, June, October. They have to have less than or equal to 2 pets per household.
Correct.
And do they like apply online or?
We send packets out to all the veterinarians. There's approximately 150 veterinarians that participate in this program. The surgeries are done in their own private facilities. We just could, and then they notify us and send us the paperwork. We reimburse them the $40. The $40 comes right off of the owner's bill at the time that the work is done.
If I had a dog, I would take it to my local participating vet and try to schedule it at a time where.
Take it to your regular veterinarian, just make sure you call and make sure that they do participate in the program.
Right.
I would say, I think there's very few that don't participate in the program. But it's been very successful for us, and we're very happy to do this to help our cause in animal control, and I think it's a good service for the community.
Okay.
Yeah, I just have a question about the post-exposure treatment.
Yes.
Is it still as horrific as we heard when we were kids, where you have to get like 21 shots in your stomach or something? Or
It is
how
not.
does that?
That was the old Pasteur treatment where they were given intraperitoneally in the stomach. Now they have the duck embryo vaccine. It's a modified live virus, and there's different protocols depending upon the circumstances. We are not involved in that. That is strictly through the health department and the physician handling the case. But it is not what it used to be. All of our officers have undergone vaccination for rabies, as I had vaccinations when I was in school. I know Dr. Rossler did. And our officers, we send them every 2 years to get their titers checked to make sure that they still maintain a protective level. Because last year we had 20 bats positive with rabies in Will County. And our officers are handling those, and you take all the precautions you can, but you don't want to take any chances, and we do not. And that's why we maintain that policy. I would also, in Will County last year, there was 61 people who received post-exposure treatment for rabies as a result of exposure primarily to these bats. People awake, there's a bat flying in the house, their teeth are so tiny they can penetrate the skin, infect you with rabies, and not even leave a mark on the skin. So anybody that's in a house that is in a semi-conscious or sleeping state, you don't know if you've been exposed or not. If a bat comes out of that house and is positive for rabies, you undergo the treatment. But I was shocked to learn that there were 61 people in Will County that underwent that post-exposure treatment last year. So this is a critical program, and thank the health department for cooperating with us with the courier service to transport these specimens to the state lab. Because time is of essence for us to get the specimens to the lab, particularly the bat that is positive that came out of a house where there's children or sleeping or incapacitated individuals.
Where is the state lab that they take them to?
It's in Chicago.
Oh, it's in Chicago?
Yes, Elizabeth would know that.
Yeah, our courier drives them down every day or whenever you.
Where is the lab? I know it's in Chicago.
Taylor
that's
Street,
all
yeah.
right.
It's on Taylor Street.
Taylor Street. Okay. One other thing I would like to add at this point is that our department is fee-based. We are totally supported on the fees that we collect through registration of animals. We have not had a fee increase since 2006, when the two-tiered structure came in, but that only affected the non-neutered pets. Prior to that, the fee structure was established in 2003, and we still are operating our department on those funds. And we have considered we could possibly increase fees, but we feel as long as we're operating in the black each year, there is not a need to do that at this point in time. So, but that is something in the future may become a reality. The other thing I'd like to point out is we're complaint-based for the most part. It's not like we're driving around looking for violations to issue people citations. If people have a complaint pertaining to animals, they call our office. We then will go out and investigate that complaint.
Right, I recently had a resident out my way call regarding a kennel that had been purchased by somebody else. I think I talked with Sheila, and then right away, they had scheduled it for themselves, went out. Would you want to give a little bit of rundown of what happened with that, Sheila? Just an example of what would happen if you call in.
So basically what happened is there was some questionable video out on the social media websites of animals being trained, particularly dogs. Well, they were dogs. And from there, some key rescue folks in the county had made a phone call, I believe to you, Judy, just asking about the video and sending the videos, and those were forwarded to us, and of course we received the videos, reviewed the videos, and then we opened an investigation. So from that point, one of our animal control officers is assigned the case based on the area it's in and does a site visit. And this time he jointly went out with an investigating officer from Department of Agriculture to look at the facilities, and this was a kennel facility. Again, this gentleman was doing training at his site, and the people that called the videos and had questioned the humane treatment of the animals. So after visiting the site, interviewing the gentleman, reviewing the videos, we determined whether or not there is a case for animal neglect and proceed from there.
All right, and so I think they did a great job with that because they determined there was no case for animal neglect. But they did have to get like a breeding license from the Department of Ag. So it was good, and it was unannounced. So they didn't know they were coming, so that way you know that they didn't clean up the place or anything in advance. So I think it was really well done.
Yeah, so what we were looking for, and what Department of Ag is looking for, is cleanliness, and that the animals are properly fed, cared for, humanely treated. And so, we do what we can within the limits of the law, and then we enforce what we can. So at this point, there was nothing found with this particular case.
Right, so that was great. Mark, you had a question?
Yeah, I have a question with regard to, before you mentioned that the state still recovers the dead skunks and does research on them?
They don't recover them, they just monitor, they just report when they see the dead ones.
But the other main part of the question was, anytime you'd see a nocturnal animal in the daylight hours, should you be suspect? Like bats in the daytime, skunks in the daytime, raccoons in the daytime?
Always suspicious about that. And
because they get confused as to when they're hunting.
The key thing is like it was mentioned that there was a skunk in the yard in the morning.
Yeah.
The thing there is sometimes they get a little confused, and even though the nocturnal animals are out there, just leave them alone for a period of time, and more than likely they're going to disappear and go back to their natural habitat in a short period of time. If they hang around for a long period of time, and even into the next day, then I would be more concerned about it.
Is skunks, best to leave them alone.
Yeah, don't get close.
Yeah.
Don't get
I do have a question.
And don't frighten them.
Yeah, okay. Doctor, you began your presentation with 4 officers, administrative officers, and over 125,000 vaccinated animals in Will County. That's quite a caseload for 4 officers. You only have 4, you've only maintained 4 for all of Will County and all of those cases?
You want me to answer that? Yeah, that is the number of registered animals. If you would look at the number of complaints and the bites that are reported to our officer, or to our department, that correlates better to the caseload that the officers have in doing the investigation of complaints and of bites.
Yeah. But 4 people handle all that caseload.
And I would just say that it's actually also the veterinarian's responsibility to promote rabies vaccination as well. So we of course get a lot of help in that sector.
But that is quite a caseload for just 4 people.
Some townships out too.
Oh, wait.
Is it right, Doc?
Yes, that is correct.
Okay, yeah.
Okay.
Let me throw that out there.
Okay.
Thank you for bringing that up. I overlooked that. My apologies.
Julie, that's a big help. Township.
Yes.
Right.
And there are only 2 townships that currently have animal control departments in our county, Frankfurt and Joliet Township. And we do cooperate with them, and they cooperate with us in certain cases and situations that we have. It gets very confusing as to who has jurisdiction where and who you call. Our department is responsible for all unincorporated areas. Each municipality is responsible for their own animal control. Some have intergovernmental agreements with us for us to handle it. Others have their own, or as in Joliet, Joliet Township, Joliet, Crest Hill, Rockdale. Frankfurt Township has their animal control. They handle Mokina and Frankfurt and any unincorporated areas in their township.
But the county handles all places.
Yes. Yes, we do investigate all the bites. If it pertains to rabies, we are the ones that have jurisdiction to take care of that.
Okay, great. That presentation was really informative. I appreciate the time you took to put this together, and I think it answered a lot of questions, and I was glad to see that Grant was here to record it, so now it'll be out on YouTube for everyone to see.
And if anyone has a constituent that calls you pertaining to an animal problem, pass it on to us. We want to hear, we want to know. Many times there are situations that we have already investigated, and unfortunately, we don't always have pleasing results for the complainant. But at least we do what is allowed according to ordinance and state statute.
Well, thank you very much. Appreciate
Thank you
your
for that.
time to come and put this together for us. Thank you. Okay, the next item on our agenda is a presentation for a grant application with the Illinois Department of Human Services for heron prevention effort. And we have Nick and Kathleen. Thank you.
I'm going to hand around something. This is more of a takeaway, so. Sorry. Morning. I'm handing around something just more as a takeaway, and we'll make that available to the other board members. Today we're just here with an informational item. There may be some future action, knock on wood, if we get this grant. So there's no action needed today, but we just wanted to give you both a quick history of what we've done with the heroin efforts, but then also this grant opportunity that came about following the most recent Heroes Health Forum, and there was a quick turnaround. So it's been the policy of the county in the past. If there's no action by the board, we still bring it to the board just so you're aware of it, but we try to do that in advance of application deadlines, but when we can't do that, we just come after the fact. So Kathleen, I'm going to let her speak in just a second, but I just wanted to set this up real quick, a quick history. As many of you know, we've had a heroin problem in Will County. We've attacked this both from an education standpoint and a crisis response standpoint. We've used our Justice Assistance or JAG grants the last several years to attack that on both ends. In 2013, we paid Robert Crown to be a consultant for us in the Valley View school districts, in the Bolingbrook and Romanville high schools. In 2014, we brought Kathleen on as a consultant to launch and administer our naloxone program, which was all grant funded. When the grant ended, her work with us ended. But that trained law enforcement throughout Will County, including our sheriff's department and local law enforcement. And that was very successful. You've probably read in the papers, a number of departments have had saves, including our sheriff's department.
Right.
In 2015, we used the JAG for the Plainfield school districts, and next week we're coming to the Judicial Committee with a recommendation that we continue this program in the Lincoln Way School District. So we're hoping to do that, to keep this rolling through the county, and maybe eventually we'll get them in all the schools. That is a train-the-trainer type program where we have Robert Crown come in and do the education program, and then they continue it on. The last thing I'm going to say, and then I'm going to turn it over to Kathleen to kind of expound on some of that and talk about the grant, is we have, because the grant ended for the JAG, and there was still interest by some law enforcement agencies to do some additional training, even though her work was train-the-trainer, they had new staff, or people just needed refreshers, and we need someone to monitor the successful application of naloxone. We have Kathleen on a very small contract. It's $5,000 at a time. It's a drawdown. We're doing that for the executive's office budget. We're hoping with this grant opportunity that some of that work will be covered. So I'm going to let her talk about the grant in kind of more detail. And if you have specific questions about any of our naloxone or heroin program, Kathleen or I will try to answer it. So.
All right, thanks. Thank you. Just let me bring you up to date on what we did last year. We trained 162 police officers and out of 22 departments. And so it was a comprehensive approach to have our officers trained to deliver naloxone, which is the antidote to an opioid overdose. And since this is the item that I taught them all to train on, and I'll pass it around. It's a nasal spray, so you put it in the nasal spray and you deliver it. It's a two-piece, they have to put it together in the field. Since then, we've had the introduction of a really much more efficient type of spray, and that's this one. And this is brand new. It's one shot. It holds a larger amount of naloxone. Often the officers in the field are having to give 2 shots because it's not bringing our folks around because our heroin is being laced with fentanyl. And so it's a stronger, more dangerous heroin, and this is manufactured by Adapt. And so in the work I'm going to be doing this now, I'm going to be training with this type of dosage and deliver. So I'll pass that around. The officers like it because it's small, it's easy to carry on them, where the other pack, because we carry 2 doses, was a little more cumbersome. One of the things that we've seen in Will County is we were on a road of diminishing our number of overdose deaths, and now we're picking up. And we can speculate whether that's because we have naloxone in the field, better education, or we can speculate that the epidemic is spreading and is serious across the country, and it's been identified by the government as the #1 focus on substance abuse is opioids overdosing. And because we have a large number of prescriptions that are being given to folks, and they get addicted to it, and they often then end up turning to heroin as a cheaper way of maintaining that addiction. It's a sad state of affairs. It's really scary, and it's crossing all boundaries in all economics, all genders, all races. It discriminates against no one. And particularly in a young group from 18 to 25, that's where we're seeing most of our deaths. So in the future, I'm going to be working with the county, and we've divided it up into 3 areas to try and focus in on the areas that have the most significant problem right now. Braidwood, Joliet are 2 of the areas that are difficult to manage. And so I'm working with Tri-River Training Unit, and they're communicating about the training programs that I'm setting up, which is a wonderful way of accessing all the chiefs in all the departments. In January, the state of Illinois passed a bill, HB1, requiring all police departments and all police and first responders to carry naloxone. So it's required now, and we're seeing a lot more interest in getting their officers trained. So the three areas, the first, on June 8th, I'll be providing a training program, as well as on June 24th too. And the Braidwood, Wilmington, Elwood, Lakewood Shores area is a pocket. New Lenox, Mokina, Frankfort, Tinley, Orland, and Manhattan is a pocket. And Lockport, Romeoville, Plainfield, Crest Hill, Naperville, and Joliet is the other pocket that we'll be working with. This will be an opportunity, rather than going from police department to police department, we'll bring them together and do more group training. That also facilitates a lot more across departmental coordination and collaboration. The reason that we were approached by the Illinois Department of Human Services is because Will County has a reputation for responding to their issue. We have a high need, a high unmet need, and so it's, in one case, it's great that we have the numbers to be able to qualify for this grant. On the other hand, it's very sad that we have the numbers to qualify for this grant. But the fact that we have already been instituting programs from a prevention and a harm reduction standpoint is significant. And that's why they turned to Will County to be the lead agency. A lead agency will lead the state's efforts in, Will County would be the pilot to introduce programmatic naloxone training to both community members, fire departments, all agencies, anyone who wants to be trained, we would be able to provide that. Right now, we do not have any community groups that train the community in naloxone. We have support groups, PATH is one of them in the area, and HERO, they provide grief support groups, but they don't do naloxone training for the community. There is a woman in Naperville who does, but we're kind of out of her jurisdiction. She would prefer that we have some of our own folks be trained that way. The other thing is that we have the capacity, Will County does, to keep the records that Will County needs and the financial departments to be able to manage the grant in a way that they require. So the purpose of the grant, they want someone designated in charge of this program. They always do. They want a point person. They are collecting data. There will be a data collection process that will be part of that grant, where we will collect the data so that other programs across the country will be comparing their results. We'll provide training for all first responders in the community, as I said, and they're looking for innovation. And some of the things that are starting to come up from the police departments is safe havens, where people can come to the police department, turn themselves and ask for help with no fear of being arrested or any kind of fallout from that. And that grant will help us implement that. I've already been approached by Mokina wanting to do that. So there are many innovative things that are possible in the community with this funding. It's 5 years, which is great, because things don't get started in a year. You want sustainability, and over 5 years, you can accomplish a lot and see those numbers go down in Will County.
So the other key questions you may have is, what we applied for was $122,500 a year for 5 years. That's what we requested. We haven't been awarded the grant yet. We're hopeful that that's what we're going to receive. And with that, it would fund, there would be no cost to the county, no match required, but this would fund a full-time position. It would pay for all the benefits and accompanying costs, and it would pay for the supplies, the naloxone supplies and everything. That was one of the questions we asked. Do we have to pay for that, or is the grant pay for it? It's all grant funded. And just for those who may ask, with all grants, the positions are grant funded. When the grant ends, the position ends, unless, and I say unless, we find the need is so great and we find other funding for it. But we know this going in, anybody we bring in for grants, we tell them that it's a grant funding position. There's no guarantee beyond the grants. And then Kathleen's proved that when we had her on the JAG, she did the work and she was done. So.
I went away and I came back.
But there ended up being a need, and so we brought her back on, like I say, a short contract. But this grant, she would be the presumptive candidate for this because she's helped with the grant application. She's been involved in all these programs. She has the relationships with law enforcement, as you can see. She's working with the Tri-County Training Group and others. So that's it as far as the presentation. We'll be back hopefully with an award and further steps to action. But if there is any other questions, we can try to answer now.
We anticipate hearing in September, October.
It's, like you say, it's good that we can qualify for it, but it's really sad that so many people turn to using heroin, and then, like you say, if it's laced with fentanyl, I don't know if people comprehend how intense that really is. And, you know, they just don't.
Well, half the time they don't know because the dealers
They
are.
don't, right, they don't know. Which is bad.
I should make one other comment. I think I've said this before to this committee, but I think it's important to note that, you know, we're friendly competitors with our peers in DuPage and Lake, and DuPage is doing a lot. They have the same challenges with heroin issues, so does Lake County. We several years back, probably 4 or 5 years, we were going to Washington, D.C. with our legislative group, talking to the National Office of Drug Control Policy. At that point, heroin was not on their radar. They were so focused on meth labs and things like that. Since then, they have recognized the importance, and it has, unfortunately, has become a national epidemic. So much so that the deputy director at the time came and spoke at our conference, and they have been very engaged with us and other counties. But DuPage was ahead of us maybe on the naloxone program. We were ahead in education, and since we've both swapped kind of information and worked together, they've been down here making presentations to the health department on their programs. But it's a good competitive thing on addressing an unfortunate problem. But I think we should be proud as Will County that we were out front. We were one of the voices telling the national government this is a problem in our community, and I'd like to think our advocacy had some role in getting them focused, and they are putting resources and dollars behind this.
Well, yeah, and you do see it on TV where they talk about it's not just heroin that you're doing, but it is laced with other synthetic drugs that make it so much more powerful, that the impact is so much more severe than people don't realize it, so.
Right. And it's good. Prescription pain pills are the lead into heroin. So we know that that's anyone who takes prescription pain pills for pain or for other reasons. We are the highest prescriber of those drugs in the world.
Right.
Yeah. When some of us went, we were at NACO, there were some presentations on it. There was a very vigorous discussion about the overprescription. When someone goes in and has they immediately want an opiate drug, and then they don't prescribe 5 pills, they prescribe 50 pills, and then they only use 5, and then they've got 45 sitting there, you know, unprotected, unsecure, and that's where you get these problems. And that's where some of I think the solutions are is reducing the overprescription of those drugs, and not having them so readily available. So,
there's a lot of movement now in medical education, and because most medical schools do not include addiction as one of their classes or lines of understanding. So you've got a lot of practitioners out there who don't understand addiction, don't understand the impact those medications have, and they're listening to the pharmaceutical agencies about the repercussions. And so there is the pharmaceutical company that made OxyContin is being sued because they said it was not addictive, and it's highly addictive. So you know, we learn as we go along, and unfortunately, some of the consequences are negative, and we're trying to get that pushed back into the bottle. You know, get the genie out of the bottle, and we want it to go back in.
Well, that's true. That'd be great, because I know my daughter, when she had her wisdom teeth out, she was prescribed some painkiller, which she never needed, but you still got it.
Yes.
So anybody could easily take that
and if underlying addiction is mental health disease, and so often if you get a prescription like that and you're not feeling really good, and you get it and you take it, you feel better, well, that starts the road about, wow, maybe I need to take that.
All the time, right?
Yeah.
Right.
It's a slippery slope.
Well, I'm glad we're going for this grant. Thank you very much. All right, thank you. Thank you. Okay, next we have, we're having replacement hires for Sunny Hill this month now. Some shake out there. Does anyone have any other new business they'd like to bring up? No? Is there any comment from the public? Anyone want to comment from the public or county board members? Department heads, no comments? I do not have any type of report or announcement, except for that, thanks again so much for coming and presenting to us. I think it's important to have our different departments come and present to us so that we can get it out to the public. I appreciate Grant being here. It gets taped so that people know what's going on and then they get an idea of, like rabies. People may not think rabies is so bad, but it's really bad if you contract it as a human. So it's very important for us to refresh everybody's minds from time to time. We don't have an executive session, so I'd like to have a motion to adjourn. Moved by Barry, second by Parker. All in favor? We are adjourned. Thank you.